Hello, Edutainment Studios and Access Healthcare welcome you to Enlarged Prostate, Easing the Symptoms. This module is part 2 of a 3-part series on easing the symptoms of an enlarged prostate. The prostate goes through 2 main growth periods as a man ages. The first occurs early in puberty when the prostate doubles in size. The second phase of growth begins around age 25 and continues during most of a man's life. Benign prostatic hyperplasia, or enlargement of the prostate, often occurs with the second growth phase. As the prostate enlarges, the gland presses against and pinches the urethra. The bladder wall becomes thicker. Eventually, the bladder may weaken and lose the ability to empty completely, leaving some urine in the bladder. The narrowing of the urethra and urinary retention, the inability to empty the bladder completely, cause many of the problems associated with benign prostatic hyperplasia. In this course, the objective is to help you know how to go about treating the symptoms of an enlarged prostate. You and your doctor will work together to develop a treatment plan to reduce symptoms and prevent complications. The plan your doctor recommends will depend on how much your symptoms bother you, the size of your prostate, your age, and any other health conditions you have. Some options include watchful waiting. This is when you meet regularly with your doctor to keep an eye on changes in the size of your prostate. This is an option for mild symptoms that do not bother you. Your diet and behavioral changes can also affect your prostate. Before beginning treatment, your doctor may recommend lifestyle changes to ease symptoms. You also can continue these changes even if you go on to try another treatment. Drinking less in the evenings and spreading your fluid intake out throughout the day are 2 approaches to lifestyle change that are easy to adopt. Avoid or reduce how much alcohol and caffeine you have. Check to see if any of your medicines are making bladder symptoms worse, including decongestants, antihistamines, antidepressants, and diuretics. Make a plan with your doctor to try and increase the amount of time between bathroom trips. Practice Kegel exercises. Practicing Kegel exercises 2 or 3 times per day for 5 minutes per session is usually enough to improve urinary control. Kegel exercises are exercise in which the muscles beneath the bladder, bowel, and in women, the uterus, are tightened and relaxed for 10 repetitions at a time. The exercises strengthen the pelvic floor, which aids bowel control and minimizes urinary leakage. There are 2 common types of medicines, and your doctor may recommend both. Studies show a combination of both medicines works best. The first type are alpha blockers. These relax the prostate muscles and bladder to improve urine flow. They help relieve symptoms but do not shrink your prostate. There are 5 alpha reductase inhibitors, or 5-ARIs. These block the hormone that causes your prostate to grow. They help relieve symptoms by shrinking your prostate. There is also a type of medicine called PDE5, or phosphodiesterase 5 inhibitors, approved to treat ED, erectile dysfunction, and enlarged prostate. If you have both conditions, this may be an option for you. It treats the enlarged prostate by relaxing the smooth muscles in your urinary tract to help ease symptoms. If watchful waiting, diet, and behavioral changes and medicines have not worked, your doctor may suggest a minimal invasive procedure or a surgical procedure. Minimally invasive procedures include treatments that use heat to destroy extra prostate tissue. They shrink your prostate and help open your urethra. Surgical procedures are treatments that either remove the enlarged part of your prostate to make it smaller, or make cuts in the prostate to help urine move through the urethra. If your symptoms are putting your health at risk, your doctor may recommend surgery. Like medicines, these procedures can have side effects. So ask your doctor about side effects, including sexual side effects, before deciding on a treatment. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 3-part series on enlarged prostates, and come back for part 3.